Good morning again, viewers, and thank you to those who have newly subscribed to my channel. It's very encouraging. Today's topic will be, I'll start from the beginning. So today we'll be discussing body changes that you will be experiencing or that you are currently experiencing because you are pregnant, heavily pregnant, even if you're just in your early stages of pregnancy. Body changes and also back care and posture. Things that you can do to make sure that you take care of your back and posture. Changes that you probably will be experiencing is swollen ankles, lower back pain, shortness of breath. You walk for short distance and then you feel out of breath. Also, when you sneeze or cough, you leak urine, and you find that you have to go to the bathroom more often than usual. Those are some body changes. Ankles. Why you have swollen ankles is because baby is weighing on you and your body is getting heavy, and long periods of standing can also cause swollen ankles as well because there's extra pressure from your womb because baby is growing inside of you. With extra pressure, and it can also limit blood flow to your legs and your ankles, so the fluid in your body will start pulling in your ankles. That's why you'll see that you have swollen ankles. Shortness of breath is caused by when so you have so when baby is growing inside your tummy, and you'll start baby is growing inside here. So as baby grows, baby will push up on your diaphragm, right? Your diaphragm is the muscle that helps expand and contract your lungs when you breathe in and out, right? So as you breathe in and out, your lungs expand and contract, and your diaphragm, when you breathe in, your lungs expand, so your diaphragm will contract to open up your lungs, and then when you breathe out, your diaphragm will relax so that your lungs can go back to its normal size as the air comes out. As baby grows, baby pushes on your diaphragm so that when you breathe in, your lungs don't expand as much as they should, right? And that's what will cause your shortness of breath. You will find that your body is taking in less oxygen as it normally would when you were not pregnant. So you'll find that walking short distance, you start getting shortness of breath, or you feel out of breath easily. These are the muscles that hold your openings. They're all your openings. They're like a hammock, the seesaw hammock. So these muscles sit in between your legs, right? And they control the opening and closing of your baby passage, your rectal opening, and also your urethra, where you pass urine, right? So every time you hold your urine, or you hold your urine when you want to go to the bathroom and there's somebody in the bathroom and you have to hold your urine, every time you squeeze, that's when you're squeezing your pelvic floor muscle. And as baby grows, baby will start to weigh, and your pelvic floor muscle starts to feel the weight. That's why you'll feel the weakness. You'll feel that it's getting weaker, so every time you sneeze or cough, you might be leaking urine as well. So those are some changes that your body goes through, and the reasons why it's happening to you is because baby is growing in your body. And last one I want to talk about was lower back ache, right? You might be feeling that you're having lower back ache. So God made us in such a way that our center of gravity is in our hips, our sacral bone, our tailbone. So when we're walking, our center of gravity, it helps us. Our center of gravity is centered there, so our body stays upright. We're walking, we're bending, everything we're doing, our body stays upright because our center of gravity is in our hips here. Okay, when you get pregnant, as baby grows in front, baby's waist starts to shift your center of gravity. So your center of gravity will change because baby is growing in front here. And because God designed our body in such a way that it ensures balance, as baby grows in front, your spine will bend more so that it keeps your body in balance. And that's why you'll start to feel lower back ache and strain in your lower back, because your body is bending more to keep your center of gravity so that you don't fall forward because of baby. All right. So that's about body changes, lower back ache, and also about the swollen ankle, shortness of breath, leaking. We give exercises for all those, and today I want to talk about back care and posture. One good way to make sure that your back is not strained most of the time is when you're doing dishes, or when you're washing the clothes, or when you're cooking, make sure you have a stool, right? A stool at the bottom. Because when you have a stool at the bottom, you can have one leg on the stool while you're doing something, right? If you have one leg on the stool while you're doing something, your back is straight, right? Your back is straight this way. Your back is straight. If you don't have anything at the bottom while you're cooking or washing, doing laundry, anything that you're doing standing, you'll find that after a while, you start to slouch and bend forward, right? You start doing that subconsciously. You won't even realize it. You'll be doing that. So if you have something that you're standing on, it helps keep your back straight. When you're doing your cooking, washing, anything on the counter, and you're not bending or straining your back. Lifting techniques: if you drop something, pick it up, 1 foot forward, 1 foot back, bend and pick. Or you can squat and pick. Don't bend and pick because you might strain your back as well. And last one is posture. When you're sitting on a chair or in the bus or wherever you go, don't slouch. Most times you do this because you feel comfortable, right? Baby's here, you think it's comfortable. What you're doing is you're straightening your back as well. Sit straight, back straight, bum all the way to the back, feet flat on the floor, and back straight. If you find it hard because the baby's in front, put a cushion at the back so it's more comfortable for you, as long as you're sitting up straight. Slouching is not good for your posture, and also it's not good for your breathing. You start feeling more shortness of breath because your lungs are more compressed when you're sitting this way. If you're sitting up straight, it helps with your lung expansion, also keeps your back straight. And yes, those are the things that I wanted to talk about today. And in my next video, I will show you exercises on swollen ankles, some lower back exercises as well, hopefully. And yes, and your breathing exercises, the breathing exercise that we talked about in the video, relaxation breathing, that's a good breathing exercise for when you feel shortness of breath during your pregnancy journey as well. All right, thank you so much for listening, and I hope you have a good week